Deputy Health Minister Dr. Joe Phaahla is set to conduct an oversight visit to Olievenhoutbosch Clinic. It's just outside Pretoria, following concerns raised by the public regarding problems at that institution that have the potential to impact access to healthcare services.
Well, we're outside of the Olievenhoutbosch Clinic. It's just outside of Pretoria. Now, the Deputy Minister of Health, Dr. Joe Phaahla, is having an oversight visit, and this follows several complaints from community members about services at this particular clinic. So he is joined by several officials from the Tshwane Clinic Forum, District Forum rather, and the MEC for Health in Gauteng, and really just other stakeholders who are all here to see how can they better the services that this particular clinic is supposed to give community members. And I'm now joined by the secretary for the Tshwane Clinic Forum or committee, and this is Mr. Percy Khosiadira. In short, tell us about the crux of why you are here today.
The reason why we are here today with the Deputy Minister, we are the governance for clinic around Region 3 and 4. With Oliven was facing a lot of issues, a lot of crimes, break-ins. So where the services were affected slowly, there were lack of medication coming in time because of there's a crime around Olive. So us as a clinic district forum, together with the clinic, this clinic has its own clinic committee. It was established, it's fully functioning. We are in support with them just to catch up and the services so that the services could go back to its order.
Do you have solutions? I mean, when you have issues of theft and a shortage of medication, for instance, that goes to the heart of a lot of challenges perhaps that this particular clinic is facing. What are the interim solutions that you're already exploring and perhaps you'll be tabling before the Deputy Minister of Health?
All those issues that we're facing, Olievenhoutbosch, us as a district forum, working together with the other stakeholders in the health sector in Tshwane, we are busy trying to unlock and escalate the issues as much as we can so that the burden for the health profession in this facility so that their work can be very easy. We are engaging also with Gauteng Department of Health so that we can work together so that we can bring our facility together back into order.
How long have you been dealing with these issues? How long have the community been complaining about some of the challenges that go to the heart of really poor service delivery, if one must say?
We only started to engage with the facility and the department. We started early January. That's where we were establishing the committee to oversee and establish a more dedicated clinic committee so that they can engage with the other stakeholders and unlock those problems. And unfortunately, since we came in, the fire has subsided a bit. And people, they can enjoy coming into the clinic. They get all the services that they were looking for on a daily basis.
All right, thank you so much. We'll, of course, hear what the Deputy Minister of Health has to say later on when he briefs the media. But I want to turn to a community member here just to get that first-hand experience. Ultimately, it is the community that needs these important services, and it's important to get that first-hand testimony from the community members. You're a community member, you were in the queue to be helped. Tell us about your experience at this particular clinic. Are you getting the services that you deserve?
Yes, this is Susan Khadebe from Extension 13, the residents of here, Olievenhoutbosch. Yeah, the service that we get here at the clinic, it's not good because we are overcrowded as people at Olievenhoutbosch. The thing that I can ask from the government is to give us another clinic maybe, because they are trying. the queues are long. Like sometimes we're coming here in the morning and then by 4 o'clock, 4:30, they're having the stress of leaving us because they can see that we are sick. The only thing that I'm asking from Olivier, from the government, just give us maybe the mobile clinics or something that can help us, because we have to spend to go to Kalafong or maybe Lodiam clinic. The only thing that I'm asking is another clinic, because these people here are trying. It's just we are overcrowded. That's all that I can ask from the government.
The issue around access to medication, do you guys struggle with that, or do you get enough of that?
We get enough medication from our pharmacy, but they are also slow because there is a lot of people there. Yeah, pharmacy is always full, but we can see that they are trying. But the medication, we get enough medication. The thing is only the long queues, because we are overcrowded as Oliven residents here.
And what else? The elderly, we've heard complaints from senior citizens who have to come very early in the morning. What's your experience there? What do you see, and what do you think maybe can they do to make it easier for the elderly?
The thing that I've experienced here at Oliven, they start with the elders or maybe the school kids or the kids that are very sick. They start with them. They are priority, and then others will come after.
What would you prefer?
I prefer they can have another facility for only the elders. Yes, so that as we can go other side. I think the elders are the first priority. Yeah, they must start with them. Also the kids. Yeah.
All right, thank you so much. There, one of the community members that is obviously, dependent on the services at this particular clinic, rather. Just talking about their experiences and also giving ideas in terms of how can government improve these services. And she's really talking about overcrowding that is obviously putting a lot of pressure on the staff here, making it a bit difficult for the province and really just government as a collective to render a dignified service to this particular community. But most importantly, her also appealing on perhaps an additional facility, and also saying that maybe if they can divide the groups, making sure that the elderly get their separate help and the rest are helped somewhere else. We'll be speaking to the Deputy Minister of Health, who is here obviously leading the delegation that is conducting the oversight visit, and this in a bit to find better solutions to improve the services at this particular clinic. For now, it's back to studio.
Patricia Vasach there reporting from Olievenhoutbosch. It's just outside Pretoria.